Sir, at the outset, I would like to thank Dr. S.K. Sareen, who I have always seen as an idol in the medical fraternity. You are our idol, I will not say that. You are one person who is not only in an institution, but the gurus of institutions. What I've seen, I was quoting in a Delhi assembly, his report for betterment of Delhi health services, and I still quote with the minister and chief minister that what needs to be done in Delhi for the better health care. Dr. Shiv Sareen, I am your, I would say I am your, you are my guru, I am your people, मैं आपका सदस्य शिष्य हूँ, मैं आपको नमन करता हूँ, इस मंच से नमन करता हूँ. आपने आज मुझे बुलाया, I feel honored, I feel privileged. Dr. Sanjay Seth, who is Minister of State, I would compliment that Prime Minister Modi ji has given 1 lakh crore for boosting the health defense sector in this budget. I would think that this is also some contribution from Dr. Sanjay Seth, who is the chief guest, and I also compliment him, thank him that I am with him today. I also thank him. I also thank Dr. Daga, the Vice Chancellor. I also thank Dr. Suman Rizal, who is the Director Southeast Asia and is looking after the national communicable diseases, especially in Southeast Asia. I feel privileged in the company of Dr. Hanuman Yadav that you called me here. Distinguished dignitaries of the dais, there are students, उधर हेरिटेज स्कूल के बच्चे भी सामने हैं, टीचर्स हैं, और ये वो लोग हैं जो आज इस वर्ल्ड कैंसर डे पर इस दुनिया को, इस देश को ये बताने वाले हैं कि क्या हमको करना चाहिए. किसी भी डे को हम लोग जो सेलिब्रेट करते हैं, सेलिब्रेट नहीं करते, याद करते हैं कि हमको दोबारा उसके लिए फोकस लाना है, कैंसर पर फोकस लाना है, क्या करना है. उस वर्ल्ड कैंसर डे की हम लोग बात करते हैं. स्टेज पर जब हम वर्ल्ड कैंसर डे की बात करते हैं तो हम बात करते हैं कि अवेयरनेस कैसे बढ़े, प्राइमरी टू टर्शरी केयर के बीच में गैप कैसे कम हो, प्रिवेंशन कैसे हो. अब जब हम बात करते हैं कि लाइफस्टाइल डिजीज़ के कारण है, मेटाबॉलिक डिसऑर्डर के कारण है, इन्फेक्शन के कारण है, तो हमको एक फोकस एरिया भी डिफ़ाइन करने होंगे, और शायद वो फोकस एरिया है हमारे प्राइमरी केयर फिजिशियन. ये दैट्स द गैप विच वी आर फेसिंग. बिकॉज अगर हम लिवर कैंसर की बात करते हैं, हम जानते हैं कि इन्फेक्शन से है, ये लाइफस्टाइल डिजीज़ है, इस तरह की बात जानते हैं कि ये अल्कोहल से होता है, ये स्मोकिंग से होता है, मे बी टू सम एक्सटेंट पॉल्यूशन से होता है. ये प्रिवेंटेबल कॉज हैं. फिर भी लिवर कैंसर एक ऐसा कैंसर है जो डिजीज़ के शुरू में डायग्नोसिस नहीं होता. एज फार एज आई अंडरस्टैंड, आई एम ऑल्सो ए यूरोलॉजिस्ट एंड शी सेड 2 decades of practice. I have more than 3 decades of urology practice. But the only thing is the early diagnosis, then that gap between primary care physician and tertiary care and also the public, this gap has to be filled. This is where the Delhi government would come into play. When we think of early detection, collective action against disease affecting millions of lives worldwide. अभी हिंदुस्तान में तो मुझे लगता है रिपोर्टिंग की भी कमी है सर. डॉक्टर सरीन सर, आई वुड लाइक टू हैव योर अटेंशन. अभी मुझे पढ़ा कि 15.33 लाख 15.33 lakhs are cancer cases in India in 2024. I think it is under reporting. Possibly the reporting needs to be improved. That's the one area where we have to have the registry, especially in Delhi, where the Google says 28,387 new cases in last 1 year. So therefore we need to have a data. Where from this data come State Cancer Hospital in Delhi, that's located in GTB area. So there has to be coordination with all cancer hospital, and not only cancer hospital, all general hospital where cancer cases come. It is not only the cancer hospital where cancer cases come, but the general hospitals also like Safdarjung, RML and Delhi Government Hospital, 26 in number, they all are having cancer cases. So there has to be some kind of a reporting method of cancer cases. Like you have a notifiable disease. I think this is now the time that we have to have cancer as a notifiable disease. There is no issue on that. Every hospital has to report that, like we are reporting communicable diseases. So this is now time, because especially in Delhi, why I am concerned about Delhi is more and more people are dying, and dying at the younger age. So average age is say 44 years in Delhi, they are dying of cancer, and because it is detected late, especially in liver cancer, because we know that fatty liver is there. Thousands of patients, you do ultrasound, then fatty liver is there, the infection is there. Then why not diagnose it early? And diagnosis has to be done at primary care level, and then there has to be linkage with primary, secondary, tertiary care with that registry system. That is what the Delhi government, we would like to do. And along with that, in Delhi, the research, education, and global cooperation should stay in people's mind each year. That's what this World Cancer Day today we are talking of. And I would like to compliment this ILBS. The ILBS is ILBS because of Dr. S.K. Sareen, because he is at the top of this institution. I was telling him, I am seeing him for last 25, 30 years when he was in GB Pant and now in this hospital. This hospital is better than any private hospital. People say कि सरकारी अस्पताल है, तो लोग कहते हैं ILBS में मेरा एडमिशन करा दो. ये अचीव किया सर आपने, या आपकी टीम ने, डॉक्टर हनुमान यादव साहब, डागा साहब, और वो जो सामने इतने लोग बैठे हैं, यंग लोग जितने बैठे हैं, ये मेरा एक यूरोलॉजी दोस्त भी बैठा जो ट्रांसप्लांट करता है, सैकड़ों ट्रांसप्लांट इसने किए. दीज पीपल, द यंगर पीपल सिटिंग इन द ऑडियंस, दे नीड्स टू बी अपलॉडेड, बिकॉज उनको ILBS को गाइडेंस मिली शिव सरीन साहब की, और उसको एंथुजियाज्म मिला, उसका उत्साह मिला. वो सामने जो बैठे लोग हैं उन लोगों का, मैं उन लोगों को भी आज के दिन इस वर्ल्ड कैंसर डे पर लिवर अवेयरनेस, लिवर कैंसर पर बात करने के लिए बधाई देता हूँ, धन्यवाद देता हूँ. The theme being united by unique, where to be people-centered approach in a medical field. The people-centered approach is the must. Every patient is different. So because as I was listening to Abdul Kalam Saab, the medicine with compassion is the base of all that people-centric approach, because if we promote compassion and we have a tailored treatment, supportive care, and this all needs to better health outcomes. Today, ILBS has brought together the government, HCPs, NGOs, survivors. There are survivors also in this audience, to work collectively towards progress, towards better prevention, better treatment care. In Delhi, again, I would like to emphasize lifestyle, tobacco are the highest incidence in metro cities. In all metro cities of the country, the highest incidence of cancer is in Delhi, and this is a growing public health issue, and that's what we are lacking in Delhi, because disease recognition has to be clinical responsibility, delay gives way to decision making, and prognosis becomes multidisciplinary. Late entry reminds us of systemic gaps in screening, in surveillance, awareness, and access. Therefore, improving outcomes in liver cancer does not begin in oncology wards. It begins in primary care, in hepatitis control, in cirrhosis surveillance, and in timely referral. On this platform, let's commit ensuring that patients enter care earlier, informed, and supported, because in liver cancer, time is not just money, time is life. That's how I feel. And especially now coming on to Delhi, our government had come out with the Ayushman Mandirs in Delhi, where the holistic healthcare center, where there is cancer screening is also done, cancer prevention is also done, the vaccination is also done. And in these care, they are primary care. So if we can diagnose these cases in primary care facilities with Ayushman Mandir, if every one of Delhi resident has a ABA card, that ABA card has all the health record of that individual, and if that patient comes to ILBS and being treated in remote corner of Delhi, you immediately know that this patient has these kind of diseases, and so you can better plan his or her treatment, better plan the prevention. The policy maker can plan how much is the disease burden, how to cope up with that, how to plan for the awareness program. And that is what in Delhi government will try to push. Have ABA card, have hospital information system. They are linking with planning for the capacity building and filling up the gaps. These are the few areas where possibly I will work with Honorable Chief Minister and Health Minister. And these all this, I also feel always that primary care, secondary care, tertiary care of Delhi has to be one unit. Sir, Dr. Sareen sir, what I feel is a private care and government care. They all has to be one unit linked with Government of Delhi Ministry of Health. That's what I feel, so that whenever there is a problem of bed availability, whenever patient is not being admitted, whether it is cancer or non-cancer, so he knows on the push of button that this is vacancy there. That's where the Delhi is lacking, and I think we are working on this with public-private hospital as one unit, linking the primary care, secondary care and tertiary care with hospital information system, and patient has a ABA card. That's the future of Delhi city. That's what we are looking for on this day of World Cancer Day on this 4th February 2026. Dr. Yadav, I would once again thank you, Dr. Shiv Sareen. Thank you once again. Thank you guiding the whole ILBS. Thank you the guiding Delhi. Thank you guiding India. Thank you, Dr. Shiv Sareen. Thank you.